new variant called Omicron, we intensified our surveillance mechanism at the international airport in Hyderabad. So yesterday we got around 70 international passengers. Total 979 passengers traveled into Hyderabad from 1st December. And when we screened with RT-PCR, we could able to identify around 13 positive cases, and immediately we shifted them to our designated health facility, and their samples have been sent for the genome sequencing to the CDFD. We are expecting the results by today evening to know whether it is a Omicron variant or the existing Delta variant. Will come to know. So Telangana government has fully geared up to meet any eventuality. We intensified our vaccination program also. Yesterday we could able to do around 3.15 lakh doses across the state. In the coming days we are further increase our vaccination coverage. So far with the first dose we could able to cover around 92% population. With the second dose with 48% population. By end of 31st December there are around first dose and second dose people 1 crore 3 lakh doses to be given. So we chalked out a action plan. As per the Honorable CM's instructions, we are travelling to all these low coverage districts to improve the coverage with the 2 doses. So that will be taken care. So at present, as far as the COVID is concerned, the situation is completely under control. Telangana, our positivity is 0.59%, our recovery rate is 98.89%. So this is not a time where the people to be panic, but definitely it's a high time to be more careful and to be attentive and adhere to all the COVID appropriate behavior, that is wearing of the mask, frequent hand sanitation, not to participate in large gatherings. So this is a time where we are going to enter in New Year, and along with the Christmas is there. In January we have Sankranti celebrations, local festival. There are a lot of local festivals are there. So when you start joining with your family and friends, so please follow the COVID appropriate behavior, and also those who are not get the job or vaccination not yet done, so please take the vaccine. Thank you. Seeing the Omicron variant, wherein in South Africa it is almost from 4 times to it has increased to 16 times within a span of 1 week to 10 days. Now last 2 days it is little bit stable, but definitely the good thing is with this variant there are not much hospitalizations, or there are not many deaths. This is definitely this is a relief, a big relief, but this is a characteristic of fast spreading. We should be very, very careful. So the way it is from within 10 days or 12 days, it has spread from 3 countries to almost more than 35 countries with 450 or 500 cases. So we have to wait and watch how this new variant is going to behave in the coming days. With that assumptions from epidemiological perspective, we are expecting a little bit surge either in the month of mid of January or February in our state.
So you said third wave.
Once the government is completely geared up, we increased our infrastructure, wherein our 27,000 oxygen beds, we created 27,000 oxygen beds in the public health system, and overall in our state there are 66,000 beds are there. Along with that, we have created around more than 6,000 beds exclusively for the children. Even our oxygen generation capacity from 125 metric tons in second wave, it has gone up to now 370 metric tons. We are trying to increase 500 metric tons our own oxygen generation capacity. Along with that, we have established PSA plants in all the government hospitals along with the private hospitals, and we placed our human resources starting from the specialist doctors and nursing paramedical staff at all our institutes, and we stored our life-saving drugs. Everything is in place. If any surge is there, if anything is there, the government or department is completely ready to take up the challenge. Thank you, sir.